Good evening. I think being the last session's a bit more difficult because everybody is already tired and maybe trying to leave it. So, but this is very most important topic for the patient organizations. That is social media for patient organizations. And you know that today we can't do anything without social media. Even governments are changed with the social media, and especially for the patient organizations to spread messages, to showcase their activities, raise funds. For all these things, you need social media. So, welcome to this great session. I'd like to invite Fatima Sidat. She's a member of a WPA African Regional Steering Committee. Fatima is the development manager at SADAG, where she focuses on innovative ways to bridge the gap in the lack of resources for people that are seeking mental health care and information. Welcome, Fatima.
Good afternoon, everyone. It's absolutely a privilege to have everyone here in South Africa. So once again, from all of us South Africans, welcome to Cape Town, South Africa. We were very excited to have this conference here because everyone brings a wealth of knowledge to us and we learn so much from everyone so far. So I know everyone's tired at the moment. It's been a long day. But social media plays such a big role in our lives. With over 5.7 billion social media users globally, and on average, people use about 2 hours, 20 minutes on social media platforms every day. And as patient advocates, we use social media to get important information out because our source of information is reliable and it is easy to understand for our patients. So, with much anticipation, I'd like to introduce our moderator for today. Well, I'm trying my best to get this right. Vildana Moy Kitch, right? Thanks.
Thank you, Fatima. You were great. And I know how to pronounce your name because my grandmother's name is Fatima. So it's one of the most beautiful names I've heard. So hello, everyone, and good afternoon once again. It's the last session for today, but I promise it's worth of your focus and attention. Before I announce it, I would like to say that diagnosis doesn't recognize ethnicity, nor race, nor religion. And this conference today, witnessing that, so I would like to thank the organizers who put us together here today, especially Triple H. It's Harris, Hussein, and Hashir, who really did a great job to share, that we are able to share the knowledge today and to learn from each other this much. So please applaud to them. So when we talk about social media, we will understand in this last session what does it mean to have relevant online communication if you're a patient organization. So I'm really privileged to introduce you to the last lecturer for today. He's a global expert in patient engagement, offering strategic advice and marketing solution to patient organizations, pharmaceutical companies, and governments. He specializes in awareness campaigns, digital strategies, social media, and launching patient organizations. So please welcome Mr. Ravi Ruparel.
Thank you. Last session, I think they used to call it the graveyard shift, right? But the good news is I'm immune from last slide, right? So we can go as long as you want today, right? Hi, I'm Ravi. I'll try to finish on time, yeah, but I don't have to. So social media, I tried to put together an agenda that would be relevant to as many people that I can. Now, some people are not using it much at all, and some people have £1 million budgets for their advertising on social media. So we're going to play a game of catch. I'm going to talk lots fast, and you're going to catch whatever you think is relevant. And if for whatever reason you didn't get it, I spoke too fast, fell asleep, please connect with me at the end and afterwards, and I'll answer your questions. Yeah? So we're going to go through, firstly, why am I okay to talk about this? And hopefully you'll see I'm quite unique, and that will convince you to listen to me for the rest of the session. Define what does success look like here? Because I think that's really important, because without understanding where you're going with this, it's difficult to get it right. And then I'm going to hit you with lots of tools, top tips, challenges, best practices, trends, and give you some case studies and show you what success really looks like. And hopefully we'll have some time for some questions afterwards. So who am I? I'm Ravi, 51, live in London. My parents born in Africa, my grandparents in India. My son, the first in 7 generations to be born in the same country as his father. So like you, I'm international. I've led health campaigns for over 10 diseases over the last 7-10 years. And I've operated in 40 countries. I've been to many of them as well. And I'm really pleased to say that the work that me and my team have done have led to billions of people being engaged in these diseases, whether that be in Rwanda, Puerto Rico, Sydney, Canada. So hopefully something for everyone. I also have cancer. And so 7 years ago, I was diagnosed. And from that moment, used social media for myself. And hopefully that personal experience is what makes this unique. The company that I set up wasn't set up to make money to help patient organizations. It used to help Ariana Grande and Pharrell Williams sell records. And when I got diagnosed, I changed it. And the organization now is like a social enterprise that covers the costs, donates, and I'll show you some examples. And because I'm a chartered accountant and an entrepreneur, there are other ways I make money. So please don't worry, I'm not going to be selling anything to any of you today, right? Later on this evening, tomorrow maybe, right? Okay, so what does success look like? This, I think, is the most important slide, right? It's not 5 billion likes. It's not, the most crazy content or crazy idea in the world. I define success for a patient organization on, are you providing education and support? Are you building a community? And are you building influence? So let's break down that a little bit. So is everything that you do actually helping people quickly? Are you connecting people with the information they really need? Are you timely? Are you connecting with all the people in your community, whether it be medical, the patients, the carers, or anyone in related comorbidities? Have you got an army behind you? This is hard work, right? You all know it, right? It's great to come here in Africa, but we're all inside the basement working, trying to make the world a better place, right? We need an army. We need mentors, donators, advisors, everyone around us. And we need to be connecting with R&D as well. And together, are we a global voice and taking this on for planet Earth, right? World Patient Alliance, right? We've talked a lot about the word patient. Coming together is what the world is all about. And that helps not only raise awareness, but also helps with financial opportunities as well. It's very hard for all the little organizations in one disease area to go and ask a pharmaceutical for small amounts of money. So I'll go over those two ends of the spectrum as to why the next 20 minutes or so, I'm going to give you lots of tips. So when I got diagnosed, I went onto Facebook and I joined Fight Bladder Cancer, where I'm now the chair of the patient advocacy group. I now have 5,000 new friends with exactly the same cancer as me, and I can access them 24/7. I can have a surgery and I could come back and I might have had some morphine, so I might be concerned about an itch in my ear, which is completely unrelated, but it's keeping me up at night. I can go onto my private Facebook group and I can ask my 5,000 friends this itch, and all 5,000 of them will tell me to go to sleep. But sometimes it's really useful because without that, I wouldn't have been able to sleep. Sometimes the information I'm given is really, really valuable, but the doctor missed it, was in a rush, the nurse was in a rush, the letter didn't come. So I found social media invaluable in my own journey. I've also seen it through my work, and this is Rwanda. I tried to pick relevant pictures, right? And in Rwanda, I was there filming a patient. We are now best friends. And he told me the story about how a radio station had found someone in the rural areas with psoriatic disease, and didn't know what it was. This person had been told, I think, by a number of people, church, family, this was a curse. And so the radio station obviously couldn't communicate a visual disease. And so they put it on Twitter. And this is how the person who I was filming, who was a patient, connected. And a year later, after this conversation, the first psoriatic disease patient organization was established in Rwanda this year. And I'm working with the global organization to do more of that across the whole of Africa. And so it was clear to me that social media wasn't just useful in London where everyone's on it. And, you know, I've got a 14-year-old daughter and she's on TikTok, right? You know, like a lot. It's everywhere. And so I want you all to know that I see it regularly, that it actually helps. There are lots of channels. So what should you use? I think you should be present everywhere. That doesn't mean you need to be active and busy everywhere. And the reason for that is that you never know when someone who needs help, what they're using, right? So being present means you can leave your telephone number, your email address, your website, whatever it might be. And it may be that you haven't put a social media post for 7 years on that channel, but somebody may find you that way and you can provide them with that help. And we don't, even though people talk about big numbers with social media, you need to be helping a few people to make a real difference, or to find one incredible volunteer, or find one person to donate. So please don't think you need like huge numbers for success, but use them all: Meta, LinkedIn, TikTok, X, Snapchat, everything, right? Be present, set them up, make sure you exist, make sure you connect. And there are lots of tools that you can use to make your life easier. Excel, let's not forget that in the modern world of AI, right? Yeah, it's still super cool, right? I'm an accountant, remember, right? Hootsuite, Buffer, Sprout, Social, all of these things are great. What's even better is a lot of you are not-for-profit organizations. These things are provided free or given to you at low cost. And not only that, they'll give you advertising budgets as well. So this isn't expensive. There are tools to really make life easy to create content, like Canva, Adobe, Spark, Lumen 5. I said catch, right? So take photos, watch it afterwards, have a look at them afterwards, and use analytics tools as well. All of the platforms have them. The main message here is make sure you're present, right? And make sure you're not paying too much for anything either, right? People like to help patient organizations. When you're posting things, people talk about adverts. Many people are allergic or frightened or scared of advertising on social media. So when you're present and you've established and you start to have a conversation, what is that? I'll show you the examples later on so you see what I'm saying. But I think we all know, has anyone not seen something on social media? Okay, great, thanks. That would have been a problem, right? So you get it, right? You can advertise the thing that you put on there. And that allows you to reach new people, because otherwise what happens is you end up talking to the same people all the time. We want to all help as many people. And I don't think anyone has completed planet Earth on social media yet. You know, no one has. Cristiano Ronaldo maybe, right? Yeah, but that's about it, right? I think it's really important to know that you shouldn't be frightened of adverts. You can have very, very small budgets, 500 euros, 100 USDs, 1,000 Rwandan francs, and Ugandan shillings of 200. You will reach additional people with those budgets. And when you start, you can increase it if it's working, and you can just stop if it's not working. And you will have all the reports to tell you, did people see? Did they connect? Did they write positive comments? Did they share it? And it's really important for you to know that you can do things in a really small way, and you should immediately see success. Some people are spending huge amounts of money, but you don't need to. I think before, if you tried to post a letter to everyone in the world, it would cost you $1 trillion or something like that. You could probably reach the world in less than £1 million now, right? That's amazing. No one really wants to do that because what you want to do is to create content that is shared naturally. So getting the balance right between advertising and organic is really important. Some of these challenges are well known. Misinformation, we've talked about it earlier. Privacy concerns, talked in AI. How much time you have? Are you going to burn out? These are all really important things, but they can all be managed. Just be vigilant. You don't do something if you don't have the resources. Make a plan. Do it over 2 years, not in 1 month. If you know your social media is weak, it doesn't need to be fixed tomorrow morning. You can take your time. So I'm not going to read everything because it's a game of catch, but hopefully there's something interesting on there for you. What do I think are the best practices for you? I think being authentic is everything, right? Be yourselves. Sometimes when people come into this world, they think they need to be talking a certain way or looking a certain way. Be yourself. Be consistent. That means if you post something once a week or once a month, don't suddenly have a mad, crazy week where you suddenly post 1,000 things. It's okay. You don't need to panic. Be controlled. Set out the rules, because when you have a page on Facebook or on Instagram, set out the community guidelines. You can say, this is for these purposes. Please don't try and sell your alternative medicines on here. If, we will kick you out, or, or don't try and sell something else. Use the data and collaborate with each other. I think given that you're all here, there's no harm in one disease area sharing their templates with another disease area, and it doesn't really happen. And you're all in the room and you've all got content and creative ideas and things. So please share away. What are the trends that are happening right now in the world? Personalization, trying to be as targeted as you can. We've talked about AI, and perhaps I'll give you an example of AI that wasn't discussed earlier. In your social media accounts, you have conversation happening. You are creating the most unique data set that exists that nobody else has. I'm working on a lab project that we're funding that is taking all of the conversations and creating AI bots so that you can have a cancer buddy that has the knowledge of 5,000 patients, which is really interesting. And that data set lives with you. Nobody else has that. Hospitals don't have any of that. So that's really super interesting. Video is everywhere, right? So I'm glad it's being live streamed. At the end, we'll have to say hello to everybody, right? Yeah, turn around, the cameras are there. Telling a story through video is magical. You can really relate. And I'm really lucky in that the 10 areas in the 40 countries I've worked, I've personally gone into the homes and met the families of many, many patients, whether it's psoriasis or cancer or MS. And that's given me that unique insight. And then I've seen what happens with those types of videos where you see someone, shed a tear or say thank you, and you feel, right? And so creating content on social media that makes people feel is really special. So I would go all in on video, all in tomorrow, because it's also quite quick to do these days. We all have a video camera on us. And so the current campaigns I'm working are all self-filmed. So you don't even need to have a film crew. Everything is integrated. Remember that when you're putting something on social media, you might be asking them to connect to your website to look at a symptom checker or a tracker, or you might want them to join your email database. So make sure that your entire digital experience is connected. And e-commerce is becoming an interesting area because self-sustained patient organizations and patients need money to buy medication and stuff. And so e-commerce is being integrated into social media as well. I'll touch on that in a little while as well. So these are trends to make sure that you don't think social media has reached its end game. There's a lot about to happen. It's not like we're going to pass off to the AI conversation. Everything is integrated. I'm going to give you some examples. So we help, and it's timely for me to come straight after Edmund. We help IFPA organize World Psoriasis Day. And what I wanted to show with this one is very small changes can transform a campaign. We all know what QR codes look like, and we made this one a heart shape. It's about family, and it makes you want to scan it a little bit more, right? And it does work, yeah? So Victor's going straight at it. Please give it a go, right? Actually, IFPO will be very happy. All of you scan it and the charts, the numbers go up, yeah? This is the campaign I did before, and what I wanted to show you is that social media content isn't just about something that's created on a computer. We were very lucky to work on a campaign to raise global awareness on heart failure. And the first thing that we did is made an anatomical heart out of Lego. And we invited, this is in Novartis in Basel, and we invited cardiologists at many, many conferences around the world to sign each Lego brick, and they added it to it. This now lives in Basel and is part of an art tour, and it's been photographed so many times, right? We've gone on and we've built Lego lungs, and we've done a few other things as well. And then we simultaneously ran a campaign where you could record your heartbeat on your phone by putting your finger on your camera, and then pass it to someone you love and record their heartbeat, and it mixed the two together and it shared it on social media. And so you had an everlasting memory of your two heartbeats. And then we used the social media account of many of the celebrities. And this is Jessie J, whose fans are called Heartbeats, I think, right? Yeah. And they all connected. The key thing being the messaging for heart failure was contained when they were donating their heartbeat. And so this case study is about showing you that originality, creativity, whether it be real or whether it be digital, is what I love, and it's what all humans love. And what that means is you can get your messages through and actually help people. This is a user-generated campaign where we had the simple task of asking people to submit a photo that was related to diabetes. Hundreds and hundreds and hundreds of content pieces were created by people around the world that showed us their patient story through art. And we ran this for 3 years, and each year the number of people just increased and increased and increased. And, you know, all of the work was done by people who had diabetes. So it was authentic, consistent, beautiful, original. And so you can run campaigns on social media in different ways. These are things I haven't done, but I want to show you what good looks like here. This lady died of cancer. Her story is incredible, but the picture isn't sad. It isn't the picture of a tumor or something like that, right? It's a human story. It makes you want to read it. Sometimes you don't need to use imagery. You can use simple words. Smoking is the biggest cause of cancer and preventable death, right? You don't forget something when you read it. And when you have a message that strong and powerful, it's okay to just use it. This is a piece of content that probably took no more than 5 minutes to create on a free tool that looks really on brand and sharp and clear. And I think is a good example of a piece of content. And I'm showing you this because some people just don't know what good looks like. And so those people that are using it a lot get used to it. But it can be this simple, right? And affordable. Am I doing okay for time?
Yeah, well,
Do we keep them?
long
Do we
discussion.
keep
No,
them?
no,
Yeah. Good. I do think it's important. This is one of those topics that questions and answers are important. But what are my concluding thoughts, right? If you're not doing anything, you have to embrace this, right? Like it's not going away. It works, and it's really helpful. Super, super powerful in so many ways, whether it's about sharing awareness messages or whether it's about you finding new volunteers or even connecting with organizations like the WPA. Be present everywhere and don't be frightened to amplify what you're saying. You will reach new people, small budgets. Make sure you equip yourself with all the right tools. They're simple, they're easy to use, they're very low cost or free. Try and template, borrow other people's templates. Make sure you automate. You don't need to be I'm probably addicted to social media. I don't know who else is going to have a go, right? Yeah, confessing something like that on a 5 p.m. in Cape Town, right? But I am, right? Yeah. And the thing is, you don't need to be on it to be using it for a patient organization. And sometimes there's this weird concept that if I start using social media for sharing messages and things, that I'm a social media addict. No, no, no. I know many organizations that only use social media for their organization's messaging. They don't use it for personal reasons at all. I know patients that will only join Facebook to join a support group, and that's it. And you know what? It's totally okay. Evolve. Things are changing. I've mentioned to you about AI and things like that. I know those things are really cutting edge, but in 2 or 3 years, we're going to be talking about patient data sets being used. I'm sure we're going to find the answers to some of our problems ourselves, right? So it's not just self-care from my perspective, but using our data and organizing it and collaborating with others is going to make a difference. So I think I've presented social media here in a game of catch, right? It can be a marketing thing, it can be a campaign, it can be something that you're doing because you want to raise funds. But what I want you to know is, find within it what works for you. Be yourselves, enjoy it. Make sure you try and do it with good quality. Other people are judging you when you're sharing something about how you look, right? Be consistent. Be on point with your messaging. There's no point in having an amazing piece of artwork and forgetting to say why you put it there. Be positive and be grateful. So thank you for listening.
Thank you for the wonderful presentation. So an hour of Q&A session now because we are on time. Yeah, we are early. Okay, I have one question before we hear from our online participants and from someone in the audience. What would be the main difference between communication strategy versus social media communication or social media strategy? Because very often we might be confused. Is there something which is above each above? Yeah.
Absolutely, yeah. Social media isn't your marketing campaign or your strategic plan. It fits alongside it. It may be that what you need to do is to put posters in community health centers that might have a QR code that link you to something. Now, the right thing is to understand that you need a plan for your operation. And within that, if there's an element of reaching people, social media is part of a plan. So for sure, what you need to do is to separate out your tone of voice, your messages, your different options, and understand where social media can fit within that. So I think communication and marketing strategy are more important. And social media is one of the ways in which you can
it be
reach your
perceived as a
gains.
tool?
Yeah,
Yeah.
exactly. Yeah, reach
Yeah.
as a tool.
Thank you very much. So do we have any question from the audience? Yeah, Victor, please. I have 8 more.
Okay, Ravi, this one was coming. So, well, first of all, thank you for your presentation. We had the honor of also having you in our academy. So thank you again for always, standing up for the patient organizations. So my question is, when we talk with our members and with other patient organizations, there is always the same issue. We are failing to engage with younger audiences because we are very good at managing, we are like boomers or whatever, we're very good at managing Facebook and Instagram and all of that, but we always fail to engage by younger audiences, social media like TikTok and Snapchat and all of that. So do you think it's possible to engage younger audience in those platforms that the basic content is, cats dancing and raccoons selling lipsticks? So what would be your recommendation?
Thank you. It's a great question, yeah. And you're right. Many people are asking us the same question: how do we reach young people? Different social media platforms are drawing different age groups of audience, and younger people are choosing to use the platforms that are anonymous. So Snapchat or TikTok or Discord or something like this, right? And so they're having more one-to-one private conversations in private ways. And what I've seen starting to work really well is the use of brand influencers in the space. And so the good thing is that even those people that are making the cat swinging videos are human beings. And once they build their audiences, if they have something that they has happened in their life, some sort of diagnosis, then we are finding that so you choose the right platforms, and then within those platforms, you find the human beings that are like us and get them to do the talking for you. And it's starting to work, right? And so what we're starting to see now is younger people starting to help each other, right? And so I think that if you are looking to target young people, look at the platforms you're choosing, and then look at the way you're achieving it. And I think that in the role of, there is a difference between a patient advocate and a patient influencer. Does anyone know what that is? Money, right? Right? Money. And so for small amounts of money, payment, because they're getting paid in different ways, you can get people to help you and talk with you. And it's okay. It's just like having an advertisement. And so those are the types of things. But it is harder because younger people kind of don't want to talk about health and stuff like that. And they don't want to listen to older people either, right? So keep trying, I think is the way. Thank you.
Is there any other questions? Yes, please.
Yeah, I
No, we
can hear you, yeah.
cannot hear you
So-
well.
So Dubai, when? Yeah, you'd like me to come to Dubai, yeah?
If you don't mind, yeah.
It's what, I'm not going to miss that chance, yeah? Thank you.
Okay, maybe I will have an exam, then you could, if you pass, you are most welcome to Dubai.
Perfect.
And with to understand how open Dubai is, we will invite our moderator as well. So my question is about the following, that I am running charity, pharmacy charity technically. So we give medicines for patients who cannot afford it. And this is among different places within Dubai. And we try really to push social media. And I was surprised they got my credit card. I don't know, there is paid ad, whatever it is. I am not a social media person, unfortunately, LinkedIn only. So, and they charge a lot. This is what maybe you call it paid ad.
Yes.
So we are behind. I see other people, we call them in our country fashionista, who get paid per dollar a lot of money, or per minutes a lot of money. Like I call someone to come make the awareness about the charity, and he asked for how much? 20,000 US dollar for 3 minutes video. And the question is, we want faster. I took all your notes here, you know. I don't know if the team will implement it and they will make an outcome for that. We are behind as a patient organization everywhere. Go to the social media. Even now, there is some machine behind that, like company have been recruited. But I believe Elon Musk, do X, or Donald Trump better than us. We want a faster solution. Even you could sell now your company saying, guys, all social, this charities, they can join us with subscription and I will pay for performance. You increase my follower, you increase the views, then I will pay.
So
I am looking for someone to help me grow faster on social media.
so the good thing is that I'm available to come to Dubai. You know, I think this, you are in exactly the same place as everybody else, okay, yeah?
Yeah.
And the good thing is this, that if you have some urgency about a transformation in your business, you can achieve it with social media. And you know, I'll give you a real example. In the last 3 weeks, I ran an international campaign for urticaria, right? Right? And so we run urticaria day.
Hives, yeah.
Yeah, I know.
We have hit 100 million people in the last 3 weeks. And we did it with 2 people and we exceeded their budget. It's not about money from where I'm coming, but what you are saying is achievable. And I think it's just a case of connecting with the right people, whether there's So what I would do, the first thing in your community is on your social media is say, is anyone out there who's my friend who can really help me to achieve a growth in my social media? You probably haven't done it. And I guarantee if we do it together in a minute, by the end of the evening, you will have your person to help you. And if not, I will do it.
Thank you. May I just add something before we have Tanya from GAP who would like to ask the question as well? Just to complement this, what would be, first, if you come to Bosnia, you will not pay 20,000 euros for the video. But the point is, what would be the difference between just likes, just the number, and the organic number? So we keep talking about trust here. And you also said, I've been listening to your presentation, that you approached to advocacy group of patients as a community because you trust them. I'm sure they didn't have good visuals.
Yes.
I'm sure that they were undercover, but you trusted them. So what is the difference between these numbers, the real numbers, and the one that we buy?
So numbers are important because otherwise you will have a page with no one listening to you, right? Yeah. So we want to grow them, right? But trust isn't defined by numbers, right?
Exactly.
Trust is defined from my perspective about the conversations that are happening on the page that you look at. And so when you join a group and someone says, I'm so sorry you had to join it, but do not worry, we are here to help you. And that's typically the first thing that is said in most disease areas, right? So I think that trust is something that your complicated human senses and body picks up when you see people having conversation and when you know that behind some digital screen is human beings. And so for me, I think that that's where it comes from. There's a lot of other parts to it, the tone of voice you are using, the accuracy, the consultation with the medical community to make sure that actually what you're saying is correct. But I think the bottom line is this, that when you know that there are human beings there, you play.
Thank you very much.
Quantity definitely matters. It definitely matters, right? But it's the trust question, I think, is not done by quantity. Of course, who is the best footballer in the world, right? Yeah, he's going to be the one with the most likes. But we're talking about health here. It's different, right? Yeah.
In Africa, but no one know me, no one sees that I am the most trusted.
So the role of, so I think the role of the patient organization is to connect with those people, the leaders in the community. There are, often you will find that you might have sometimes 2 or 3 patient organizations in one country, and you may find 2 individuals that are not connected with any of those with more of a voice in that country, right?
Mm-hmm.
And so I think that they should all get together, right? And so events like this and opportunities to connect will help.
But this is also what we were talking about with with the Gretel tool for policymakers. We have the ability to do that for social influencers. So the same tool, we can tell you in each country, in your disease area, who are the social influencers, what channels are they active on, and what are the key themes or messages that they are interested in based off of their recent post. So that's
very valuable.
I mean, that's the type of powerful use of AI,
Yes.
even in this space of social media strategy, that I think, we can leverage as well.
Absolutely.
Yeah. So my
Yeah.
question was actually about video and the use of video. And we heard earlier the 9 seconds attention span of most individuals. And video is everything on social now. I think that our attention spans, the interest. So in that use of storytelling and video, but with the limitation of that first 9 seconds, like what are some of the best
Got it.
tips around engaging video?
Okay, great question. So the way I approach video, if I have to interview a patient, is that we would record as much as we can, right? So the full interview. And then what we would do is edit that in so many different ways to suit different purposes. What's very popular, the first normal point of contact with a patient video story will be on Instagram Reels or TikTok or something like this, and people have less than 9 seconds, 3 seconds. But the point is that what we will do is also make the longer version available on YouTube. We will post the 3-minute version onto Facebook. And so the idea is sweat your content as much as you can and use it everywhere, right? And have a 3-second, a 3-minute, a 5-minute, a 6-minute. Heck, have an hour and try and sell it to Netflix. Why not, right? Yeah. And so I'm of the approach of making sure you really, you know, be everywhere and have everything in a way that can be accessed everywhere. To edit a video is about, for 5% of the time, a patient video. I'm not talking about a big film that takes a long time, right? But patient videos can be edited very, very quickly. And so I would encourage you to record everything. And also when you record everything, you may find that you've recorded something that may not be quite right for this video, but later on down the line, you may change the theme of a campaign, use it at that point in time.
Okay, we have a question. Thank you from Aviva Communications from Pfizer.
You're amazing, and I am so grateful for the service that you provide to so many advocacy groups. I would love to hear, you talked a little bit about what good looks like. I'd love to hear, like, who are your favorite brands or organizations to follow? Who, like, what are some handles that we should all be following as examples of, like, they are doing content and storytelling right?
Wow, okay. I'm not here to sell to you, so I'm not going to list my favorite projects I delivered, right? Yeah. Unfortunately, the West and Europe have a huge head start. And so I would look at design practices from Australia, America, Canada, Europe, and adapt the style that you see to your local country. I think that you must take into account like your local. I've seen campaigns where there's been just one QR code with one word. And it's so powerful because you just want to do it. You don't know what's happening. You don't know what the brand is. You don't know, like, you just go, I need to do this, right? And you just go and do it. I'm not going to choose anything I like in particular, but personally, I love art. And so when you have something that's wildly creative, something you've never seen before, so I'm a curious person, excited by something I've never seen before. And so for me, the best thing I've ever seen is the thing I've never seen. And that's how I'll answer the question. And from that, I'd want you to activate your creativity and try and do something that you've not seen somewhere else.
Thank you, Ravi. One more question?
Okay,
So we-
sorry.
Okay.
Thank you. I stepped out a while, so I don't know, maybe you've mentioned this. Is not really a question, but what about countries that there's restrictions, there's policy on social media that they
Fantastic
cannot
question.
post? How do they address it concerning patient advocacy?
Okay,
Because we have some country that
Yes,
their
understand.
social media is regulated.
got it. Yeah.
Thank you.
So I have firsthand experience. It's a great question. Not everything is capable of being regulated or restricted. And if we all know that even if you are in a country like Afghanistan or China, where there are heavy restrictions, you can still provide care. And for that, you have a range of social media or messaging tools that I didn't mention, like Telegram, that are extremely private and have been designed for that specific encrypted private use of sharing messages. And what we have found is that Telegram is one of the options that you can connect with people for your health awareness. And so I don't believe that everything is restricted. It's just a case of finding the way that people are, because, you know, when you need help, you are going to do anything you can to get help. And so find the ways, Discord, Telegram, there's a number of those types of applications that people are using. And we have firsthand experience of women in Afghanistan using private Telegram accounts for women's diseases in really, really good ways. Yeah.
Thank you. And final question from Hussein, CEO of WPA.
Yeah. Well, Ravi, I really enjoyed your presentation. I thoroughly enjoyed last presentation, but you know, you made our day. I think we all struggle with social media, no matter we run a local organization or we run an international organization. And as an organization ourselves, we have tried everything. We've given it to a company to run it. It's really not working. We have done it, internally, you know, maybe it's working, but not the way, you would really like to have it work. So what I'm saying is that, if it's a problem at all levels, are there any resources available? Are there any training programs available where the patient organizations can go and get some training on? We would, definitely would like to promote that among our own membership. So we have a huge, large membership base. But if not, you think it's not a specific tailored sort of a thing for patient organization, maybe, there's something that we should be doing, and making a new,
Well,
maybe training program,
So
if
this
that's
is
what's required.
this is a lovely way to end. So
Yeah.
I will send you a list of things that I think are good,
Mhm.
but if it's not complete, CEO to CEO, I'm happy to donate to the WPA a set of training that we will create together for everybody.
Oh, that's it.
Oh. That's very.
I think that will be very invaluable for all of us. I think I'm telling you, I'm struggling. I'm still struggling.
Yeah.
I really don't know how to, uh, you know, know what my target market is globally. Who to go target, because all of these classifications within
Yeah.
these social media are based on,
I understand.
normal industry, but not patient advocates. So how can you,
Yeah.
in America, should I look for patients? Should I look for
Yeah.
somebody in Brazil or in Nigeria or in India? So
So
how to?
I think you are voicing what everyone feels like,
Yeah.
overwhelming, like fear that this task is too big. Relax. You're doing a great job. Look, your first conference had how many people in the photo?
Yeah.
Remember, how do we define success?
Hmm.
Success is defined by, are we helping? Are we growing? Are we building a community? You're doing everything great. We will make things improve together, but don't be overwhelmed or view this in any way.
Good. Thank you very
Now,
much.
I spoke about last slide. I do have one last slide. Has anyone got the last slide? Yeah.
Let's
So,
move.
you thought my last slide, right? Is my last slide there?
Is it? No,
Is it there?
no.
Oh, no, it's gone.
No,
So-
no, it's not.
It's not, is it?
No, we're gonna.
Is there one? Let's
go
have a go.
there.
Let's go through it. Ah, here we go.
This-
Please, I've just made a room full of friends. Stay connected, right? I've just spoken about social media. If you don't connect me on social media, we'd have done something terribly wrong. The reason to connect with me is that if you have any questions, please connect back. I will answer every single one of them.
Okay, thank you very much. Please applause for the Ravi. It was very fruitful panel discussion. You were great and we really appreciate your presentation. So I would like to call the chair of this session, Ms. Fatima. Did I pronounce it well? Yes. Okay, to give us final conclusions of the session.
Okay, so I know it's the end of the day and we're all looking forward to going to tour Cape Town. So I'm going to keep this really short and sweet. Thank you, Ravi. I think your information has empowered many of us today, and you've helped us understand social media so much better. I think my takeaways from this presentation was authenticity. And how do we build authenticity with our patient advocates out in all the different platforms? And the one thing that really sticks with me is real people, real stories. And that's what works for many of us. So when we are trying to get our messages across, it is so important to use the real people, all your patient advocates, to get their messages out there. Because how often do we look into social media to find someone we can relate to, someone that we can understand, and someone that's going through something similar to us? And that's where our stories, our information will relate better with the people that are seeking for our help and are looking for that information that they so need on social media to help them get through what they're going through. So for me, that's one of the biggest key takeaways I have. I think just to add on to Ravi's presentation, hashtags are important. Because if you look at hashtags being used on every social media platform, that's how you're going to grab your audience. So choose the right hashtags, whether it means you, on our side, we use hashtag mental health matters. It reaches over like millions of people. So use the right hashtags when you are posting, because that's where you're going to get your reach, you're going to get your new followers, you're going to get new interaction with different people. And I think just to conclude, social media is very important, again, because we are relating stories, we are relating information that is critical for different healthcare purposes. So let's make use of it. Ravi is going to give us a bit of a insight into how to do this better. And together, I think what we have to do, we have such a big network now. Let's use each other to relate each other's different programs. We use our, we share our information. Like he said, let's collaborate and let's try and make a difference. Thanks so much, everyone.
Well, that was quite a session, as they all were. I will say that I hope everybody feels that we delivered on what we promised today, that you found all of these sessions valuable. Okay, thank you. That was helpful. Okay, so I hope you found, I thought this was an amazing day with amazing speakers and content. I just want to again thank the Regina and the conference committee for all of your hard work in getting this agenda and these great speakers together. And a big thank you to all the speakers for the valuable, valuable information that will change all of our nonprofits. I'm sure of that. And I can't wait to see these training modules, because I know every person in the room has a problem with social media. So that's the great thing that comes from these conferences, is honest feedback, and then a solution will come. So this is great, really great stuff. We start again 9 o'clock in the morning. We have a coffee break now, so you can continue the side conversations outside. Enjoy that. The board has to run to a meeting in about a half hour, so don't think we're leaving you. We're going into a 6 o'clock meeting. And from that, we will see you at 9 a.m. tomorrow. One more thank you to the WPA staff, as well as the conference committee, and of course, our sponsors. Thank you all. We'll see you at 9 a.m.